All right, ready to go behind the scenes. Today we're going to be looking at pre-op care, all the stuff that happens before someone even gets to the operating room.
Oh, I like that.
Surgery is a big deal, so whether it's planned or an emergency, knowing what goes into that prep work is crucial.
Definitely.
Our source material today is actually, it's framed like a YouTube video script all about this pre-op care.
Interesting.
So just imagine we're watching it together, but, we're giving you the real behind-the-scenes insights.
Uh-huh. I like it.
So right off the bat, the source material just hits you with this question. Does this patient need surgery?
Yeah, they really emphasize the weight of that decision, like making sure it's really necessary.
It makes you stop and think, there's got to be a lot more to it than just a simple yes or no.
Oh,
Yeah.
absolutely. The source material breaks it down into three main parts: the patient's condition,
Right.
the risks involved, and then the expected outcome. So it's not just about what's wrong, but like the whole picture.
Right. Makes sense, because I guess surgery might be possible, but is it actually the best thing for that person?
Exactly. And I love how they actually visualize this whole decision-making process. They use this image of a scale,
Yes.
balancing the risks and benefits, which, when you're a patient and you're facing this really complex decision,
Yeah,
that image can be really powerful.
definitely. I mean, it's weighing those potential downsides, right?
Yeah.
Against whatever you're hoping to gain.
Hmm.
Now, the source material also brings up elective surgeries versus emergencies.
Yeah.
I feel like that would totally change how fast you got to make that decision.
Oh, absolutely.
Yeah.
In an emergency situation, like imagine a ruptured appendix or a bleeding ulcer.
Ooh, yeah.
That scale we were talking about, it totally tips. The risks of not operating right away are just huge.
So in those moments, it's less about, weighing all the options carefully and more about just got to act now.
Exactly. Time becomes the most critical factor.
Okay, so let's say they decide to operate, whether it's, after all that thinking or it's an emergency. What happens next?
Well, that's where pre-op assessment comes in.
Yeah.
And the source material describes it like piecing together a puzzle.
Okay, I like that.
Each piece of information adds to the overall picture of, how healthy the patient is and if they're actually ready for surgery.
So it's like more than just those routine forms. It's gathering these like vital clues.
Yeah. They have a whole checklist: medical history, physical exam, lab tests, imaging, even these tools to figure out the patient's risk level.
Oh, and I saw they mentioned this thing called the ASA classification. What is that? Some secret medical society thing.
Haha, no, not quite, but it is an important part of the puzzle. Anesthesiologists use it to kind of rate a patient's overall health.
So it's like a grade, like an A+ patient is good to go and a C patient, maybe not so much.
Yeah, you could think of it that way. It helps predict how well they'll handle the surgery and the anesthesia, and it helps the medical team decide what level of care they need.
Huh. So it really makes the approach more personalized.
Right.
It's not just looking at numbers on a chart.
Definitely. And the source material really stresses how important communication is during pre-op.
Yeah.
It's not just gathering data, but building that trust and understanding with the patient.
That makes sense.
Yeah,
Surgery can be a scary thing, so feeling heard by your doctor, that can make a huge difference.
absolutely.
Okay, so they've done all these checks, they've got all this info. The source material then talks about pre-optimization. Love that word. It's not just checking boxes, it's actively making things better.
Right. It's about getting the patient in the best possible shape to face surgery and recovery.
Mm.
The source material breaks it down into three parts: medical, lifestyle, and teamwork.
Let's start with medical optimization.
Yeah.
What does that actually mean?
It's kind of like fine-tuning, making sure any existing conditions are well managed. For example, if someone has diabetes, it might mean getting their blood sugar under control.
Oh, so it's about preventing problems by, taking care of those vulnerabilities beforehand.
Yeah.
Okay, what about lifestyle changes? That seems like a lot to ask of someone who's already prepping for surgery.
I know, it can be tough, but the source material makes it clear that even small changes can make a big difference. They talk about things like quitting smoking, changing your diet a bit, and even just like light exercise.
Some people might say that's putting too much pressure on patients, on top of everything else they're going through.
It's definitely about finding a balance. The goal isn't to overwhelm them, but to empower them. Even cutting back on smoking or just short walks, those things can really help their overall health.
So it's about working with the patient, not just telling them what to do.
Exactly. And that's where the teamwork part comes in. The source material emphasizes how important it is for everyone to work together: surgeons, anesthesiologists, nurses, even physical therapists.
Like a whole team of experts making a plan for each patient.
Precisely. It's all about coordinating care and using everyone's expertise to make sure the patient has the best chance of a successful surgery and recovery.
This is all so interesting. It's amazing how much happens before you even see the operating room. But what if even after all this optimization, someone still isn't quite ready for surgery?
That's when the source material brings up something kind of surprising. Sometimes they actually delay the surgery.
Really?
Yeah, it's like saying, hold on, this isn't a race. Taking some extra time to make sure the patient is as healthy as possible can actually lead to a better outcome in the long run.
It's like that saying, measure twice, cut once. You don't want to rush into something as big as surgery if you can improve the chances of things going well.
Exactly. And they give a great example in the source material. A patient with, say, poor lung function. Rushing them into surgery could be really risky because of the anesthesia. It might be much safer to work on strengthening their lungs first, maybe with rehab, before they even think about the operation.
So sometimes waiting a bit is actually the smartest move.
Yeah.
It's putting their long-term health first, not just getting the surgery done as quickly as possible.
Right. And this whole discussion makes me think about something that the source material kind of hints at throughout. This YouTube video, it's aimed at patients.
Oh yeah, I see what you mean.
It's really emphasizing the importance of informed consent and the patient having a say in their own care.
It's not just doctors making all the decisions. It's about giving patients the knowledge so they can make choices about their own health.
Exactly. The more they understand about what's going on, the risks, the benefits, the more they can be involved in the whole process.
Now that we're talking about the patient's experience, I'm curious about the mental side of things. Surgery, even when it's planned, can be pretty nerve-wracking.
Oh, absolutely. It's a huge thing to go through, and it's totally normal to feel all sorts of emotions leading up to it.
For sure.
Our source material doesn't have a specific section about the psychological stuff, but it's woven throughout.
How so?
Well, remember how they talk about open communication being so important and building trust with the patient? That goes a long way in helping with those pre-op nerves. When patients feel like their doctor is really listening and understands, it can really ease their anxiety.
It's like knowing you've got a team on your side helping you through this whole thing.
Right. And it's not just about emotional support. It's also about giving clear and accurate info. When patients know what to expect, they feel more in control.
So all that detailed assessment we were talking about, it's not just for the medical stuff. It's also a chance to talk through any fears and answer questions and just make the patient feel more confident and less uncertain.
Exactly. That partnership between patient and doctor is so valuable.
We are looking at this through the lens of a YouTube video, though, which can't cover everything in depth. What are some things about psychological preparation that you think might be missing here?
Well, the source material doesn't really go into different ways that patients can cope with anxiety. Things like mindfulness, relaxation exercises, or even support groups.
It's like giving them a toolbox full of ways to handle the stress of surgery.
Yeah. And it's important to remember that everyone's different. Some people might sail through pre-op without a worry, while others might feel super anxious or even scared.
So it's about finding what works best for each individual.
Exactly. And another thing that often gets missed is the role of loved ones. Their support is huge. Surgery isn't just something the patient goes through alone, it affects everyone around them.
The source material talks about teamwork within the medical team, but yeah, the patient's own support network is super important too.
Absolutely. Including loved ones in the conversations, addressing their concerns, giving them resources so they can help the patient, all of that can make a big difference.
It's about building a support system that goes way beyond the hospital.
Right. And even though the source material focuses on pre-op, we got to remember that this emotional journey keeps going into the post-op phase too.
Recovering from surgery can be tough, both physically and mentally.
For sure. Addressing the psychological needs throughout the whole experience is really important for the patient's overall well-being.
Okay, so we've talked a lot about the physical and mental prep that goes into pre-op care. It's really complex.
We have, and even though it's just a YouTube script, the source material does a really good job of highlighting the key points.
I agree. It's like we got a peek behind the curtain and saw that surgery is way more than just the operation itself.
It's a whole process, a journey that starts long before they even get to the operating room.
And it takes a ton of planning, clear communication, and that real partnership between the patient and the medical team.
Well said. And one thing that we haven't talked much about is the practical logistical side of getting ready for surgery.
Oh, you mean the actual, like, nitty-gritty details that patients need to know so everything runs smoothly?
Exactly. The source material focuses more on the medical and psychological stuff, but things like what to wear on the day of surgery, when to stop eating and drinking, what to expect right after the procedure. Those things can be really stressful for patients if they're not addressed.
It's like a whole set of things you got to do to make sure everything goes according to plan.
Right. And they might seem small, but these details can really affect how the patient experiences the whole thing and how much peace of mind they have.
I bet patients have a ton of questions about that stuff.
Mm.
What are some of the most common ones you hear?
One of the biggest ones is about fasting. Patients usually have to stop eating and drinking for a certain amount of time before surgery, and that can be confusing or even a little scary for some people.
Yeah, especially if they have certain health conditions that mean they need to eat regularly or take meds.
Exactly. So clear instructions are super important. The medical team needs to explain why fasting is necessary, answer any questions, and make sure the patient totally gets it.
What about medications? I bet that's another tricky one.
Oh, yeah. Patients need to know which meds they should keep taking and which ones to stop before surgery. It depends on the type of surgery, the meds themselves, and the patient's overall health.
So there's a lot of room for things to get mixed up, and that could be dangerous if the instructions aren't super clear.
Definitely. That's why it's so important to talk to the doctor and ask any questions, clarify anything that's unclear, even double-check things just to be safe.
So it's about the patient being in charge of their own care, making sure they're informed and speaking up.
Right. And it's not just about asking, it's about sharing info, too. Patients should tell their doctors about any allergies they have, supplements they take, even if they've been sick recently, even if it seems small.
It's like putting together all the pieces of the puzzle, like we talked about.
Yeah,
Every little detail matters when you're trying to make sure surgery is safe and successful.
absolutely. And another practical thing that people sometimes forget is having a support system.
You mean having someone to help with rides, taking care of things after surgery, and just being there for them during recovery?
Exactly.
Yeah.
It's really important to have someone you trust who can go to the hospital with you, speak up for you if you need it, and just help you with everyday things while you're getting better.
Like having a co-pilot to help navigate all the post-op stuff.
Yeah, exactly. And this is something you should talk about and plan ahead of time. Patients need to figure out who that person will be, tell them what they need, and make sure everyone's on the same page before surgery day.
Okay, so we've talked about a lot of the practical stuff that goes into prepping for surgery.
Yeah.
It's amazing how many things need to be taken care of to make the whole experience go well.
It is. And even though it might seem like a lot, knowing all this can actually be really helpful.
It's like knowing the rules of the game before you start playing.
Right. And that actually leads perfectly into the next part of our deep dive, where we'll look at what happens after the surgery, the post-op phase.
I'm ready for that. I'm really curious to learn more about what that part of the journey is like.
Me too.
Yeah.
But before we jump into that, let's take a minute to think about everything we've learned about pre-op care.
Good idea. It's been a pretty wild ride so far, hasn't it? From deciding whether to operate to all those detailed assessments, all the ways to make things better beforehand, and now all these practical things that can make such a difference.
It's clear that surgery is way more than just a medical procedure. It's a mix of science, psychology, and logistics.
And you need to look at the whole picture, taking care of the patient's physical needs, their emotional needs, and the practical stuff every step of the way.
Exactly. And I think the biggest takeaway from all this is knowledge is power.
Definitely. When patients understand what goes into pre-op care, they can make better choices, speak up for themselves, and just feel more confident about the whole experience.
Well said. Now, are you ready to explore post-op care? To see what happens in the next chapter of this story?
Absolutely. Let's dive in. Okay, so now we're getting to the part after the surgery's all done, post-op care. I feel like we've already learned so much just getting to this point.
It really shows you how much goes on behind the scenes even before they go into the operating room. But yeah, now we're switching gears, looking at what happens after.
And I'm guessing post-op care is super important, like maybe even more important than all that prep we talked about.
Yeah, you're totally right. It's all about making sure the patient recovers well, helping their body heal and get back to normal.
Makes sense. But it's got to be about more than just, like, the physical healing,
Well,
right?
absolutely. Remember all that stuff we talked about, the emotional side of things? Well,
Right.
that doesn't just disappear once the surgery's over.
Right, they could be in pain, feeling uncomfortable, maybe even a little scared or unsure of themselves.
Exactly. So it's not just about fixing the part that was operated on. It's about taking care of the whole person.
And remembering that recovery takes time. It's a process.
It is. And just like before the surgery, communication and that feeling of teamwork between the patient and the medical team, that's super important.
So they still need to feel heard and understood and like they've got support every step of the way.
Yeah, definitely. Our source material doesn't go into detail about specific post-op care, but there are some key things that usually happen that are worth talking about.
Okay, so what are some things patients should know about or be ready for during this time?
Well, one of the big ones is pain management. They'll focus on controlling the pain, but trying not to use strong meds that could have bad side effects.
So it's like finding that sweet spot where they're comfortable, but it's not slowing down the healing. What are some ways they handle pain after surgery?
It depends, every surgery is different, every patient's different, but usually it's a combo of things. Meds, physical therapy, sometimes even other stuff like acupuncture or massage.
Sounds like they really personalize it, figuring out what works best for each person.
Yep. And that's why it's so important to talk to the doctors and nurses. Patients shouldn't be afraid to say how much pain they're in or if they have any worries. They got to work together with the medical team to get it right.
So being their own advocate,
Yeah.
basically.
Exactly. Another big thing is taking care of the wound. Keeping the incision clean is super important so it doesn't get infected and heals up properly.
So making sure it's covered, watching out for signs of infection, following all the instructions the doctor gives.
Right. Might be stuff like changing the bandages, using special soap, even knowing what to look for if something doesn't seem right.
So they're really involved in their own recovery, not just waiting for the doctor to fix everything.
Exactly. And then as things start to heal, they'll focus on getting their strength and movement back. Physical therapy is a big part of that.
So I'm picturing exercises and stuff designed to help them move better and get stronger over time,
Yeah, it could be gentle stretches at first, then more challenging stuff as they get better.
like slowly rebuilding, getting back to where they were before.
You got it. And we can't forget the mental and emotional side of things. That's super important too during post-op.
Yeah. What kind of things might people struggle with emotionally at this point?
Well, like we said, surgery can be a really big deal emotionally. They could be tired, uncomfortable, maybe feeling vulnerable because they're still healing. Plus, they might not be able to do all the things they used to, and that can be tough.
So it's about helping them with those feelings,
Yeah.
reassuring them, giving them ways to cope.
Yep. Sometimes that's support groups, maybe counseling, or even just someone to listen to them and be there for them.
Like a safety net to catch them if they're feeling overwhelmed.
Exactly. And then as they get further along in recovery, there's this whole other thing, getting back to their normal life.
So figuring out how to go back to work, do everyday activities again, maybe making changes if they have to because of the surgery.
Right. It's about giving them the tools and info they need to make that transition as smooth as possible.
Like a map to guide them back to their regular life.
I like that analogy. And it's important to remember everyone's different. What works for one person might not work for another. Recovery doesn't look the same for everyone.
So it's about tailoring everything to that individual, their needs, how fast they're healing, what their goals are.
Absolutely. And that brings us back to something that's been really important throughout this whole deep dive, that partnership between the patient and the medical team.
Yeah, it's not about the doctor just telling them what to do. It's about working together, talking openly, and coming up with a plan that feels right for everyone.
I couldn't have said it better myself. That teamwork, that shared responsibility, that's what makes a surgery successful from the very beginning all the way to the end when they're fully recovered.
Wow, we've covered so much today, all about pre-op and post-op care. It's amazing to see everything that goes into it, all the planning, the expertise, and the care that helps patients get through it.
It really is, and it shows how dedicated and skilled the people working in healthcare are, but it also shows how important the patient's role is in their own healing.
Knowing what to expect and understanding how things work, that gives patients the power to make good choices, speak up for themselves, and feel more confident throughout the whole process.
Couldn't agree more. And to everyone listening, thanks for joining us on this deep dive. We hope you learned something new and feel more prepared if you ever have to face surgery yourself.
Until next time, stay curious and take care.